Infections, or the risk of infections, are a common challenge when treating patients with non-healing wounds. Infected wounds are often characterized by the presence of increased exudate, slough, and non-viable tissue. This creates an ideal environment for the further growth of bacteria and fungi, and subsequent development of biofilms. Biofilms are clusters of bacteria and fungi embedded in the wound environment. They can form within 24 hours and are difficult for the immune system and antibiotics to eradicate. New research shows that biofilms can be found everywhere in the wound environment, both in the surface of the wound bed but also in the tissue below the wound bed. The presence of biofilms can lead to infection, inflammation, and delayed healing. To promote optimal healing, it is best practice to first cleanse and debride the wound to remove slough and non-viable tissue. This will remove some, but not all, biofilms in the wound. Cleansing and debridement should be followed by the use of a dressing that manages exudate by conforming to the wound bed and has an active component effective against biofilms. The challenge with conventional foam dressings is that they leave a gap between the wound bed and the dressing. This gap allows for exudate pooling, which may promote bacterial growth, leading to increased risk of infection. Biatain Silicone Ag with 3D Fit technology is a conforming dressing specifically designed to manage infected wounds or wounds at risk of infection. 3D Fit is a highly absorbing foam technology with strategically placed microcapillaries. Upon contact with wound exudate, the microcapillaries absorb the exudate vertically and triggers the release of Ag. At the same time, Biatain Silicone Ag conforms to the wound bed to stop exudate pooling and delivers a sustained release of Ag at the wound bed. The exudate is locked away and retained even under compression, reducing the risk of maceration and spreading of infection to the wound edges and peri-wound skin. In an in vitro test, Biatain Silicone Ag has been shown to kill 99.99% of mature Pseudomonas aeruginosa biofilm and to prevent biofilm formation. In another in vitro test, Biatain Silicone Ag was exposed to fresh bacteria or fungi every day for 7 days and was effective against a broad spectrum of bacteria and fungi, showing a sustained release of Ag. Patients get the full benefit of infection management, combined with conformability, vertical absorption, and retention. 4 factors that support optimal wound healing conditions for infected wounds. Biatain Silicone Ag with 3D Fit technology combats infection and biofilms where it matters.